Good morning, everyone. I'll be talking about evaluation of the fellow eyes of phacomorphic glaucoma. As we all know that phacomorphic glaucoma is an ophthalmic emergency where the patient presents with painful eye, and we have raised intraocular pressure, a shallow anterior chamber, and total intumescent cataract, and the management involves the control of intraocular pressure and cataract extraction. Now, as per the previous literature, the common risk factors for developing phacomorphic glaucoma are advanced age, a female gender, a shorter axial length, and a shallow anterior chamber. As we can see that these are the risk factors which are also shared, and these are going to be present bilaterally, and these are the risk factors which are also shared by the angle closure diseases. And out of all these, the shallow anterior chamber depth is the one which is having a higher preponderance or having a higher risk of converting into an angle closure disease. So considering the overlapping risk factors between these two diseases, we aim to evaluate the incidence of angle closure characteristics in the fellow eyes of patients with phacomorphic glaucoma. So retrospectively, we collected the data of the patients who were diagnosed with phacomorphic glaucoma between January 2020 till September 2024, and we collected the demographic profile as well as for the fellow eye, visual acuity, intraocular pressure with Goldmann applanation tonometer, anterior chamber grading on slit lamp, gonioscopy, lens status, disc status, axial length, anterior chamber depth, and lens thickness was noted. So in the 57 months of study duration, there were 87 cases of phacomorphic glaucoma that were identified. The average age of presentation was 62 years. As we can see that around 40% patients were falling between the age group of 61 to 70, and the remaining 22% were falling on either side of this. Most of the patients, 64%, were female. The best corrective visual acuity in the fellow eye in almost 68% patients was better than 20/60, and when coming to the intraocular pressure, almost 94% patients were having an intraocular pressure of less than 21 mmHg. Coming to the lens status, around 49% of the patients were having a cataract in the fellow eye, 45% patients were having a posterior chamber lens in the fellow eye, and 6% patients were having a clear lens in the fellow eye. Now, when evaluating the anterior chamber grading and gonioscopy, we excluded the eye who have already underwent an intraocular procedure, as this is going to change the normal anatomy of the eye. So the patients who were having a cataract or a clear lens in the fellow eye, we documented the anterior chamber grading and gonioscopy for them. So when we see on this, around 27% patients were having a grade 1 angle on slit lamp evaluation, around 17% patients were having a grade 2, 6% patients were having a grade 3, and around 50% patients were having a grade 4 angle on anterior chamber grading. For gonioscopy, in the patients with cataract and clear lens, the gonioscopy was performed in around 36 patients only, and in 12 patients, the gonioscopy was not documented. Out of the 36 patients who have underwent a gonioscopic evaluations, the angles were open in 19 eyes, and that is amounting to 53%, and around 47% of the fellow eyes were having a closed angles. If we look onto the axial length was available only in the 19 eyes, and it was around 3.06 mm, and the average lens thickness was around 4.25 mm in the fellow eyes. As we can see that in the previous literature, as by Mohigmi et al., they have concluded that around 75% of the fellow eyes of the phacomorphic glaucomas, they do have closed angles on gonioscopy. And Keels et al. Have also documented that a shallow anterior chamber is one of the risk factors in patients with mature cataract, which can develop to phacomorphic glaucoma. In our studies, around 47% of the fellow eyes of the phacomorphic glaucoma were having a closed angles on gonioscopy. So my take-home message is that a gonioscopic evaluation of the fellow eyes of the phacomorphic glaucoma should always be done, and if possible, a prophylactic peripheral iridotomy can be planned in the fellow eyes of the patients of phacomorphic glaucoma if a shallow AC also noted. Thank you.
Thank you.
We have the next speaker, and we'll take the questions at the end after the group
this is,
photo.
I think, something that we do anticipate, that it will be a shallow AC and angle closure. But how about the lenses? I mean, what was the lens thickness like, or what the intumescent? Did you measure that or grade that? Because that's probably more important.
Yes, sir. Actually, the lens thickness in the contralateral eye was available only in the 18 patients. Limitation being the retrospective study. In the data that was available, the lens thickness was enlarged. It was around 4.25 mm.
So why do you postulate one of them went into phacomorphic then? Is it they delayed the procedure, or because there's also female preponderance? So do you have any hypothesis on that?
Sorry, sir, I couldn't get the question.
So we are seeing that there is one of the eyes went into a phacomorphic glaucoma, right? The other eye, you're looking at the fellow eye. So did we see what the cause for asymmetry was? Was it a delayed procedure, like one was pseudophakic already and therefore the other eye probably got, they didn't get it operated for a long
that
time?
was a significant reason because 50% patients were having PCL implantation in the fellow eyes. And the other eye was presented as a phacomorphic glaucoma. So this could be the cause that they have presented late in this.
Yeah, so that's a postulated thing that's been looked at.